Thank you so much, Mr. Speaker. Members, I grew up in Orange County, went to Orange County Public Schools, K-12, including University High School, go Cougars. And in my summer of my junior year, we took these health, life science type of classes, and it included at the time what was absence-only education. And I have to tell you, it was not education. And in fact, a facilitator of this presentation in our auditorium tried to use gum as an example to refuse to women students who have already engaged in sexual activity as if they were now used up, if you will. Another facilitator used a basket of mint and asked each one of us to take a mint in an effort to make a commitment to her that we would not engage in sexual activity before marriage. And the reality is, all of these programs, not educational, but they're not age appropriate in the sense that so many of our 16, 17, 18-year-olds are faced with very unique and sometimes dangerous places and decisions. And it's really important that we teach young people in an age-appropriate and evidence-based manner issues of consent, issues of body image, issues of self-esteem, ways to say no, ways to look for an enthusiastic yes, the concerns with STIs and HIV. And so what this amendment would do is ensure that there's comprehensive, medically accurate, and factual information that is developmentally and age-appropriate. And those terms are defined in the amendment to provide what I like to call a healthy adolescence act. This type of information would ensure that regardless of what family situation you have, and again, your parents can opt you out, of course, but you would be able to access in an age-appropriate way this type of information to keep yourself healthy, safe, and strong. That's the amendment, members.
Now, Representative Eskamani, you're recognized to close on your amendment.
Thank you, Mr. Speaker. Okay, members, I want to be real with y'all. So, I grew up in a working class family. My mom passed away when I was 13 years old, before my period even started. And it was very difficult because I didn't really have people I could talk to about my body changing, about healthy relationships, and I did not know what consent was. And part of age-appropriate, comprehensive sexual health education is good touch, bad touch, right? We teach young people the anatomy of their bodies and what is appropriate and inappropriate when it comes to the adults or other young people around you. It also does teach the importance of trusted parents and trusted adults. The best sexual health education programs integrate adult conversation and try to build that trust between young people and their parents or guardians. So if you care about abstention from sexual activity, there's actually data to tell us that good, comprehensive, age-appropriate sexual health education actually prevents sexual activity because young people not only understand consent and how to navigate peer pressure, but they understand the consequences. And so they make decisions that are much more responsible than if they're just getting their news information from music videos or other types of media out there. So this is a really smart policy that we've seen a reduction in STIs and HIV rates alongside unplanned pregnancies. And I like to think that every parent is having those conversations with their young person, but in families like mine, that never was the case. And so this amendment comes from a full heart and clear eyes, and I hope folks would consider it. Thank you, Mr. Speaker.
Representative Eskamani, having closed on our amendment, will now proceed to vote. All those in favor of the amendment signify by saying yay. Yay! All those opposed signify by saying no. Show the amendment fails.